So, Andy, John, what do you see as being the biggest problem or threat when it comes to healthcare cybersecurity for hospitals?
From my perspective, it's user behavior. I mean, how many people open phishing emails, John?
So we do some automated phishing campaigns, and when we first started, we were over 20% failure rate. We've since driven that down, but Andy's right. Users are a big component of that.
Yeah, because it doesn't take. I mean, you can encrypt laptops all you want. You can, you know, set up whatever, but all it takes is someone writing an Excel spreadsheet to an unencrypted thumb drive, and you leave it on the breakfast bar at Shoney's, and that's it for your security in one sense. I mean, that's not the worst thing that could happen, I suppose, but that's pretty significant. That could be big fines. So and we are making data more and more available to end users. I mean, we've got all kinds of ways to get data out of our system now, and so it's not really locked down, and everybody gets read the riot act about HIPAA and IRB and all that kind of good stuff. But ultimately, especially when you've got freewheeling academic doctors who feel like nobody should restrain them at all, that could be, that's a vulnerability for us in particular, I think.
Not unrelated is ransomware, which may come in through user bad habits, phishing, etc. Um, what's your take? Pay, don't pay? There's quite a bit of variance on that.
I think, obviously each organization is going to be different. I know there was a healthcare entity in Indiana recently that I think ended up paying, I think what amounted to about $50,000 in Bitcoin, which, I think that was an amount that the hackers basically said, we feel that that organization is going to be willing to pay that, and that's where we're going to set it. From a FBI standpoint, their stance is don't pay. Because A, you don't know if you're really going to get those keys to decrypt your data. B, who knows if they're even going to come back to you. And C, they may just want to come back for more if they know your vulnerabilities. But obviously that's going to be an organization decision. Because if you're turning away patients and you can't take care of patients, that's a whole nother ball game versus maybe just being impacted for a period of time. Obviously you don't want to see multiple security incidents, but I think it's going to be an incident-to-incident decision. If we've got maybe just a few computers or maybe a one department shared drive that got encrypted, that's a whole different scenario as compared to having thousands of workstations down, So I think it's going to vary. And from our personal standpoint, I think, again, we're going to try to stick to that stance of we're not going to pay. We're going to rely on our processes and our cyber insurance to kick in.
Do you see any potential solutions to break the hold of hackers and ransomware for hospitals?
As we see more patients taking their own data with them, I mean, the Apple thing is just the tip of the iceberg there, where people are going to download records. Now, clearly, that record they download is not going to be the comprehensive, the inpatient record with all the, flow sheet rows and MAR entries and all that stuff. But it's going to be basic stuff with notes and diagnoses and medication lists. I mean, as they take that data with them and possess it in some form, that might change the equation as far as the value of that data for ransom. Because if we get enough distribution where people basically own their own data, it's all sort of distributed out to everybody, then it's not concentrated at the hospital. And in some future state, it may be not an issue anymore if you can say, well, okay, you lost my record, you lost my anesthesia record from my operation, but you can resync up with me, and I can give you back my medication list and your notes from the past 2 years and all this kind of stuff. And that I have to feel like that's going to have some effect on how attractive this type of ransomware stuff is going to be in the future.